My journey into stroke research began after watching my father struggle with unexplained symptoms for weeks before his stroke. Doctors later told us that recognizing these early warning signs could have potentially changed everything. That experience motivated me to gather evidence-based information about these crucial pre-stroke indicators that many people dismiss. Unusual headaches were my father's first warning sign. These weren't his typical tension headaches. They were sudden, severe, and unlike anything he'd experienced before. Research from the American Stroke Association shows that approximately 35% of stroke patients report experiencing distinct headaches weeks before their event. These headaches often don't respond to over-the-counter medications and may change in intensity or location. Cognitive changes were subtle but significant. Dad started having brief moments of confusion and difficulty finding words during conversation. He'd pause mid-sentence, struggling to express simple thoughts. Neurologists at Mayo Clinic have documented how these temporary cognitive disruptions can occur when small blood clots briefly interrupt blood flow to certain brain regions, essentially mini warnings of a larger problem developing. Persistent dizziness and balance problems appeared about 3 weeks before his stroke. He'd occasionally need to steady himself against furniture when walking through the house. According to studies published in the Journal of Neurology, these balance issues stem from early circulatory problems affecting the cerebellum and brainstem, areas controlling coordination and stability. Vision disturbances manifested as brief episodes where he complained that things looked strange. Sometimes objects in his peripheral vision would temporarily disappear or appear distorted. Ophthalmologists working with stroke centers have identified these transient visual changes as possible signs of retinal vessel insufficiency, directly connected to the same vascular systems affected during strokes. Unexplained fatigue hit him hard about a month before. This wasn't ordinary tiredness from poor sleep, but an overwhelming exhaustion that rest didn't improve. Research from the National Stroke Association indicates this exhaustion may result from the brain working harder to maintain normal function despite reduced blood flow to certain regions. Numbness or tingling sensations came and went in his left arm. He'd shake it off, attributing it to sleeping positions or muscle strain. Neurological studies have shown these sensations often result from temporary interruptions in nerve signaling due to compromised blood vessels supplying specific nerve pathways, essentially dress rehearsals for a potential stroke. Mood and personality changes were perhaps the most overlooked sign. My typically calm father became unusually irritable and anxious. Neuropsychiatric research has demonstrated that these emotional shifts can occur when blood flow becomes compromised in brain regions governing mood regulation and emotional processing. What makes these warning signs particularly dangerous is how easy they are to dismiss. Headaches get attributed to stress, fatigue to overwork, cognitive lapses to aging, and mood changes to life circumstances. But when these symptoms appear together or represent a change from your normal patterns, they deserve medical attention. Tracking these symptoms properly can make all the difference. I recommend keeping a simple journal documenting when symptoms occur, their duration, and any potential triggers. This information is invaluable to healthcare providers assessing stroke risk. Individual risk factors significantly impact your likelihood of experiencing these warning signs. High blood pressure, diabetes, smoking, high cholesterol, family history, and previous cardiovascular issues all amplify risk. Knowing your personal risk profile helps contextualize any symptoms you might experience. Always consult healthcare professionals immediately if you notice these warning signs. Modern diagnostic tools can detect stroke risk long before a major event. Imaging techniques like carotid ultrasound, magnetic resonance, angiography, MRI, and CT angiography can identify blockages or narrowing in critical blood vessels. Simple blood tests can also reveal factors that increase clotting risk. Preventive measures can dramatically reduce stroke risk when warning signs appear. Medications to manage blood pressure, reduce cholesterol, or prevent clotting might be prescribed. Lifestyle modifications, including dietary changes, exercise programs, and stress management techniques, can also make a significant difference in outcomes. Time management becomes critical when symptoms emerge. The faster you seek medical evaluation, the more options remain available. Modern interventions can often prevent a major stroke when warning signs are addressed promptly.